Hi, this is Dr. Nagendra Sardeshpande, and this is our ongoing discussion on Mullerian abnormalities or abnormalities of the uterus. So, coming down a little more, we'll come to abnormality of the vagina. That is called as vaginal. There are two types: vaginal septum and vaginal agenesis. So, there is something vaginal septum is a very interesting condition wherein there is a partition in the vagina. Now, last time we talked about a vertical partition in the vagina, which is usually associated with a double uterus or a uterine septum. Here we have a transverse partition in the vagina dividing into two upper and lower halves, and which can be completely closed, the partition, or it usually has a small hole from which the menstrual blood comes down, and hence they usually come either they're unable to get pregnant or they are unable to have relations. So in which case we see that opening in the vagina, we identify that septum and cut the septum to access the upper part of the vagina and open out the complete vagina. The other condition is absent vagina, and often it is associated. There are various conditions for absent vagina. The commonest that we encounter is something called as MRKH syndrome or Mullerian agenesis. That is the Mullerian. Now, vagina is developed in the upper part by the Mullerian ducts and the lower part by the skin of your buttocks and your perineum. And what happens is that the upper part of the vagina does not develop at all, and the uterus also is absent. And sometimes you may have small uteri lying on the side in the tummy, but which are of no functional value at all. Ovaries are usually normal in these women. Now, this is called as an absent vagina or Mullerian agenesis, or also called as MRKH syndrome. Usually, these women do not appreciate the problem till they reach puberty, when they do not get menses. So they will wait for maybe 2-3 years after they reach around approximate age of puberty, and then some of the parents realize that something is wrong. They otherwise normally develop their normal feminine female development, and only thing they don't menstruate. And then when we investigate, we find that she has just a small little vagina, what is called as a blind vaginal pouch. So what do we do in such situations? Normally at that period of time, if they are teenage group, we don't treat it. However, once they plan sexual activity or they plan marriage, that is the time we intervene, and we do a procedure called as a vaginoplasty. Now, in vaginoplasty, it's a very simple procedure. We can do it. Generally, the commonest route is vaginal route. That is, from below, we make a small cut in the vagina and open up the space inside between the bladder in front, the urinary bladder which collects the urine, and the bowel, that is the anus, and the rectum behind. We create a space between that, and we use something to line. We put a mold inside. We put a small plastic mold inside, and we use something to line that space that we have created. Previously, and even nowadays in some centers, they use something called a split thickness skin grafts, that is usually from the outer side of thigh. They use a very thin layer of skin, the superficial cells of the skin, and create a lining, a membrane out of that, and line that area, which will go and line the and which will help to create that new vagina. However, there is a disfiguring of that outer part of the skin of the thigh, and that is one aspect. And sometimes if we by mistake take a little more excessive thickness of the skin, they can start growing hair inside. So that is something you have to be very, very, very careful about. The other things that we have started using in the last maybe 7 or 8 years or so are two things. One is something called as amnion graft. Now, there are certain select centers in India and in the world over, which when the baby is delivered, the placenta, part of the placenta, there's a membrane called as amnion on that, which is frozen, which is collected, which is tested for that it is free of any disease, and it is frozen. And this we can use to line that vagina, and it creates a beautiful vagina after that. It basically, all these materials act like a scaffold on which the vaginal lining, the vaginal cells, and the vaginal skin grows up and forms a nice vagina. And the third thing we use is something called as oxidized cellulose, or something called as interseed, which is a degradable biological material which is used to line the space that we have created in vaginoplasty. All these techniques are equally effective. It is your personal matter of choice. There is also a laparoscopic technique, so which I apply in case of failed cases of vaginoplasty, Otherwise, I personally prefer the vaginal route, in which, in case of laparoscopy, we go up, open up the lining of the abdomen, create the space in the vagina, and use pull the lining of the abdomen down to line the vagina and create a cavity. The vaginal technique works well for most of us. Hence, we probably would prefer it over the laparoscopic technique, personally. What is important for these women is they use dilators, or there are something called as glass dilators which are available, and they have to use them subsequently till they get married and they have intercourse, because that is one of the important keys to the success of your procedure.